of rehab was not felt. But because of now, because the nuclear family systems, the support system from the families, from the home is not much. And lack of infrastructures are definitely there in India since long time, and now that because the population is increasing and improved versions of healthcare has been demanded from all around the country. Focus was always on the acute care. When the patient getting some disease, we have to just treat them. But what to be next? The quality of life was not very important for them. If any patient getting stroke, you must have seen many people in your society and in the cities also, while traveling also many people having some kinds of hand and leg disabilities are not able to speak. This is very common. The quality of life is not important for that time. And lack of insurance coverage in the rehab facility is this is also very important point. Like in the Western countries, they have all the insurance companies cover the rehabilitations, but in India, it's not covered. And we have required lots of manpower, infrastructure. They're very intensive and it's very slow process because rehabilitations has to be continue for many months, maybe for many years for some patients for the lifetime also like Parkinson's disease. So these things are very important and very expensive. So what is the future scopes? General population in urban areas slowly realizing the need of the rehabilitation. So now because the COVID times, we now having lots of telecommunications and this teleconsultations and telemedicine has very much focused on in the last 2 years. And some insurance companies they started the support for the rehabilitation, but large number of startups are working on developing like robotics and the virtual reality for rehabs. We have very few centers, one centers in Hyderabad I think, and Delhi, maybe one two centers like Vedanta and Bombay, one two centers only, where they work on the robotics and virtual reality. National Medical Council also has developed guidelines making rehab departments essential medical college. But this government medical college, this rehab centers not active and not so promising. They just for the namesake they have rehab centers there, and because in the private hospital also, they because very expensive they don't support the rehab center. So we have this opportunity. These two things are important. I just this morning I was listening about the things about the imaging processing like different MRIs. Dr. Goel was saying about the MRIs, the fMRI, even the MEG also, the PET inspect, the processing to predict the stroke in the populations that we can work upon that. And then the EEG and intracranial EEG, now this is called ECG, you must know it. And now there's something called stereo EEG has also come upon. It's a 3D mapping for the source localizations in the epilepsy patients, where they can predict an outcome also, where we can predict about the outcome of the patients. And definitely after post strokes, we require different types of telerehabilitations with the at home rehab with the robotics where they can help and they can get some help from the robot. The rehab robotics with the prosthetic and exoskeletons is we know since long time, but how can we do on the on the larger populations which need to think over. And the early intervention is very important because as the time progresses, I show you the time is brain. As the time progresses, the disability is become permanent. Definitely to prevent stiffness of limbs and to prevent the permanent disabilities. And definitely the automated wheelchairs. Definitely we see automated wheelchairs, but should be the improved versions with a different technology. So that is because I just finished in the 10-15 minutes because I wanted to have some more questions and answer with you and your comments and your what we can do from that. Yes, sir.
What was the last one? Yes. You are saying diagnosis of the stroke, early diagnosis. Often, why somebody would go to MRI? It is so costly.
Like in the Western countries, what they have is that there's a family history of some neurological disease, even the cardiac disease they have. They go for the regular screening after the age of 40 or 35 years. If their father, mother, and the parents, if any of siblings getting kind of any Parkinson's disease or any migraine issue, or they have any kind of neurological issue, they got the heart attack. So it is very common in Western countries, they go for the regular screening. Even the patient having the GI cancer, colon cancer, or intestinal cancer. So they have been advised by the doctors in every year you do go for the colonoscopy to prevent the for the this now is the last. So definitely right now this economy issue is there in India, but for the future just predictions, if some person's father and mother both got the stroke, you can predict with that, if you have any change in the brain, different software or maybe the different imaging sequences, you can predict how this patient can get stroke.
I understood that.
Yes, sir.
But will it not result because it's very clear that my man had the initial symptom of a stroke would enhance that whole thing.
Yes, sir. So this definitely we discuss about many things on the cognitive also. Definitely mental health and the psychological issues also have impact on the health. That is very well known. But that also we have to. That's why we need nowadays the counseling to the patients become very important part. We need to counsel such kind of family members. To make it.
Doctor differently.
Yes, sir.
See, what you are saying is, in Western countries, first of all, we are copying Western countries. FMRI will give constant connectivity and all those biomarkers will come afterwards.
Yes, sir.
But what is the root cause? Root cause is explained that the blood clot is
Right.
why that is happening
Yes, sir.
and why we can't prevent. Go to the Indian knowledge system, tell the wellness, tell the yogas, and tell all those things which will never. So instead of saying that why we should not get the root cause, you are saying you develop all the Western habits and then please go for FMRI. This is the different way of catching the whole thing.
Yeah, that's why I told about the primary prevention. Primary prevention is seeing about the lifestyle management and going about
So
treatment.
what we should focus is the primary prevention. Not saying that please go for FMRI, and I will tell you, even in the last stages, the people who have gone through EEGs have developed the stroke. EEG will not give really this. So there are many ways, and so instead of saying this part, we should love to tell that primary prevention should be the
Yeah, definitely there is a best part, but some populations will never, yeah.
That's right.
Yes, yes.
But my point is